Hey guys, in today's video, I'm going to be talking about low-dose Accutane for anti-aging. If you're new here, welcome. My name is Andrea. I'm a board-certified dermatologist. I'd love it if you would subscribe to my YouTube channel and hit the thumbs up. It really helps my videos out a lot. All right, I've gotten this question for a few years now. What do you think about taking low-dose Accutane for an anti-aging benefit? Can it help things like wrinkles and fine lines? If you're not familiar, Accutane is a retinoid that is FDA approved to treat acne. And while it's FDA approved to treat acne, we actually use it off-label to treat a variety of skin conditions and skin issues. And one thing that we use it for is for chemo prevention in people who are at risk for developing skin cancers. So over the past, several years, it's kind of been the thing to consider prescribing low-dose Accutane for improving the visible signs of photoaging. If you've never heard of Accutane, it's isotretinoin. It's a retinoid. It gets a really bad rap unnecessarily, especially on the internet. There's a lot of fear-mongering. People think that it's really, really, intense and dangerous and all of this stuff. I mean, truthfully, antibiotics have, many similar adverse side effects, and nobody thinks twice about taking antibiotics for a sinus infection or anything like that. But we have this idea that, acne is this thing that, shouldn't need medication. It's just naturally going to heal, despite the fact that, it disfigures people. All that rambling aside, yes, Accutane does have some side effects. Probably one of the most common is dryness and irritation. With a low dose, though, you can kind of get around that, and it's not as drying and irritating. There are some systemic side effects that can occur and some lab abnormalities that can occur. And so blood work, you have to monitor blood work while you're on the medication. Because of this, taking Accutane, it's not just like taking a multivitamin. It's kind of involved. Low-dose Accutane at a dosage of 10 milligrams given 3 times a week, or a dosage of 20 milligrams given 3 times a week daily to people who have prominent signs of photoaging, namely older adults with prominent wrinkles, textural abnormalities, hyperpigmentation related to chronic sun exposure. When they were given Accutane at these doses for 3 months, at the end of the study, there was actual histologic evidence of increase in collagen fiber density with Accutane. So it does boost up collagen production in the deeper layers of the skin. There are also studies showing there is improvement in skin texture, overall skin tone, and people are happier with the way that their skin looks while they're on the Accutane. And another benefit of Accutane is a reduction in a marker called P53. Which is basically kind of a sign of UV damage to the skin that ultimately, could lead to a skin cancer. It's not surprising that we see that go down in the skin because we view Accutane as having a chemo preventative aspect to it, and it certainly does. That's why we use it off-label in people who are very high risk for making skin cancers. So you see that. I mean, you could consider that an anti-aging benefit, but that's not really what people are looking for as far as the cosmetics. They're looking for an improvement in wrinkles, texture, tone, and all those things. And yes, you can see that with low-dose Accutane. 10 milligrams 3 times a week, 20 milligrams 3 times a week. There's really not much of a difference as far as side effects between those 2 doses, and there's really no statistical difference in collagen thickness, the amount of collagen produced, the degree of wrinkle smoothing or anything like that between the 2 doses. Another randomized control trial, though, really didn't show much of a difference with Accutane as far as an anti-aging effect. They looked at 32 women, 20 milligrams, again, 3 times a week, plus moisturizer, plus sunscreen. And then the other group took no Accutane and just used moisturizer and sunscreen. And at the end of 3 months, there really was no difference between the 2 groups aside from a statistically significant decrease in P53 in the Accutane group. So that's, that's speaking to the speaking to the chemo preventative aspect of Accutane. So it was really okay, this doesn't seem to be much different than just using a moisturizer and just using sunscreen. They showed improvement in skin elasticity, but it really wasn't much different between sunscreen and moisturizer versus sunscreen, moisturizer plus Accutane. So I want to point that out because using sunscreen and moisturizer, I'm telling you guys, it has skin benefits. People are always like, oh, surely there must be something else we need to be doing. I mean, yeah, it really can benefit the look of your skin, the health of your skin for sure, to protect it from the sun and to moisturize it. It's very simple, and the studies here show that as well. All right, so that's all well and good. Accutane, you know, it improves collagen, you know, it may increase collagen production, smooth out wrinkles, improve wrinkle depth. But is it really worth it? Here's the thing. There was a study, there have been studies actually that compare it to kind of the gold standard topical retinoid, tretinoin, for anti-aging. That is FDA approved actually to improve the visible signs of photoaging. You apply it to your skin as opposed to taking this pill by mouth. So by applying it to your skin, you don't have to worry about things like your liver enzymes, you know, being elevated and having to monitor that. You don't have to worry about things like triglycerides. You don't have to go through blood work monitoring. I mean, it's like more convenient. And honestly, the study looked at, what did they do? They did oral Accutane versus topical retinoid. Oral Accutane 20 milligrams a day versus topical retinoid for 6 months. At the end of the 6 months, I think they switched the Accutane group over to doing tretinoin. Anyways, they showed no difference at 6 months between the Accutane group and the tretinoin group as far as improvement in wrinkles, texture, skin coloration. They certainly did show benefit with the low-dose Accutane in the study, but it was no different than the benefit that they also demonstrated with using topical retinoid, using tretinoin or retinoid. Renova, for example, I think is what they used here. So no difference between low-dose Accutane and topical retinoids. Here's what I think about taking low-dose Accutane for an anti-aging benefit. I think it's kind of, you know, to me, the risk to benefit is just not there. I say just use topical retinoids. You don't have to expose yourself to, you know, potential risks. Although, again, I want to emphasize, Accutane is a safe medication. I would not view this as preventative for wrinkles. If you're a young person in your 20s, you know, adolescents, I don't think being on this long term for an anti-aging benefit makes no sense. To me, it's really to improve the visible signs of existing photo damage. Again, though, when you're in your older years, you're more likely to have other medical comorbidities. So is it really going to be the best idea to be taking a medication and, you know, kind of unnecessarily that could potentially interact with whatever other medications you may be on? That's a conversation to have with your doctor. And do you really want to spend your time having blood work monitored? How long would you have to actually be on Accutane to maintain that benefit? You know, it's not like it stops collagen destruction from happening permanently. However, if you're an older adult, you have a lot of photo damage and you make skin cancers, namely squamous cell carcinoma and actinic keratoses, those pre-skin cancers, then, you know, to me, it's like, okay, I can see having that conversation at that point. But, you know, otherwise, I think going through taking low-dose Accutane, I don't know, it seems like more work than it's worth, in my opinion. That's just my opinion. I think you can get very good results with topical retinoid as far as boosting up collagen production, fewer side effects, and, you know, you don't have to go through the monitoring and whatnot. And for women of childbearing age, even if you're not interested in having children, it's not like the easiest thing to take Accutane because you have to go through this pregnancy monitoring. You have to have these negative pregnancy tests all the time. I mean, it's kind of a pain. And most physicians are probably not going to, I wouldn't feel comfortable just prescribing Accutane to a woman of childbearing age with no acne and no medical condition for, you know, anti-aging benefit. No, I mean, so that just doesn't make sense. You're far better off using a topical retinoid. It just doesn't make sense to put yourself at that risk. Even if you have no desire to have children, you're still gonna have to go through the iPledge program here in the States and you know, have monitoring for negative pregnancy tests. That is a pain and a lot for you and your physician to keep up with for, you know, a theoretical endpoint of fewer wrinkles, which we don't even know. These studies, they look at people with wrinkles at baseline and a lot of photo damage at baseline. They show that Accutane improves the look of those, which makes sense, you know, by boosting up collagen production. But it's not like it's going to prevent that. So in addition to topical retinoids, which are, you know, easier option to deal with, no monitoring, do your sun protection. That is really what's going to be preventative. So I would say that that's probably a more logical choice. Now, another group of people who might enjoy low-dose Accutane are people who have not necessarily acne, but really oily skin. Accutane causes the cells within the pore, the sebocytes, those are the cells that make oils. It kills off some of those, and it helps in reducing oiliness. So, you know, a side effect is very dry skin. But for some people with super oily skin, prominent pores, they appreciate going through a course of Accutane, maybe at a low dose for a while, to reduce some of that excessive oiliness. Again, it's got to take your whole medical history into account before, you know, saying yes or no or jumping on it. So, you know, that's another situation where you may find that it's beneficial to you for cosmetic reasons in terms of improving oiliness. Long story short, in my opinion, I say just stick to the topicals. You don't have to go through the monitoring. You don't have to worry about the side effects. I mean, there's side effects with topicals. They dry out your skin, they can be irritating, cause peeling and whatnot. But so can the oral medication. The oral medication does that for sure. And then, you know, you've got to have blood work monitored with the oral medications, which you don't with the topicals. So that's my opinion on it. You know, I would not take it myself personally because I don't want to have to go through iPledge. And, you know, while I'm not planning to get pregnant anytime soon, yeah, I mean, that being said, one other note about Accutane and pregnancy, I brought this up in my Accutane video, but just because you take Accutane, it doesn't affect your ability to conceive or to have a healthy baby in the future. Once you stop taking Accutane, you have to refrain from conceiving for 1 month, and then, you know, you're fine. It's gone after a month. You do still need to use contraception for 1 month after stopping Accutane, but after that, you're good. But, you know, I actually do have a lot of male colleagues who do take low-dose Accutane for, they say, these are older adults, and their reasons were the chemopreventative thing and smoother skin, wrinkles. So I do have a lot, I have encountered male dermatology colleagues in particular who do take low-dose Accutane and find that they like the way their skin looks. Treating anti-aging, yeah, risk to benefit ratio, to me, not quite there. The number one thing though that you can do for anti-aging as far as stuff that you put on your skin or, you know, invest your time in, beyond the lifestyle factors of sleeping and, you know, eating a balanced diet and not binging on alcohol, not smoking, and not, you know, stressing yourself out, is to protect your skin from the sun. I mean, 90+% of aging of the skin has to do with UV exposure. The rest is, you know, genetics and some lifestyle things, smoking and that sort of thing. All right, guys, I will list in the description box my references for these studies that I mentioned. This is just my opinion on the off-label use of Accutane for anti-aging. So, you know, we all differ in our opinions. Comment below though if you take Accutane for something other than acne. I think that'd be really interesting to see in the comments below. If you like this video, give it a thumbs up, share it with your friends, and as always, don't forget, sunscreen and subscribe. I'll talk to you guys tomorrow. Bye.